Improve your health. Sponsored by Agape Care.
Nearly half of Americans say they've gained weight during the pandemic. That's according to a recent survey. And if you are one of them, you may be thinking about going on a diet. But there are so many to choose from. How do you pick the right one?
Oftentimes when my patients say, well, what diet should I be on? What's the best one? My answer is always the best diet for you is one you can stay on long term, one that has the most sustainability and one that you're happy on. If you're on a diet and it's nothing but deprivation and you're miserable, that's not the right diet for you, and chances are you won't keep the weight off.
Kristen Kirkpatrick is a dietitian with Cleveland Clinic. She says we ultimately have to decide for ourselves which diet is best. Diets aren't one size fits all, and she recommends picking one that's easy for you personally to follow. She reminds us some diets have more research behind them, like the Mediterranean diet, which emphasizes fruits, vegetables, olive oil, and fish. And then there's the DASH diet, which focuses on foods to help lower blood pressure. And then there's also a newer combination of the two called the MIND diet.
And that diet has been shown with rigorous adherence to reduce the risk of Alzheimer's and dementia by about 53%. So this is really a brain boosting diet. This year, a lot of my patients and a lot of trends are going towards how do we improve our brain health. So the MIND diet, I think, is another great option.
Kirkpatrick said her patients have also done well on the ketogenic diet as well as whole foods and low carb approaches. If you're having trouble deciding which diet is right for you, make sure you speak with your healthcare provider.
Next on News 2.